We're connected. I'm
We are
here.
connected. Perfect, Jesse. Thank you very much for agreeing to do this with me. I greatly appreciate it. I know you're busy, so I thank you very much.
No problem. This is exciting.
Yeah, this is cool. It's very cool. So I'm very excited to speak with you today. Oh, hold on a second. Let me shut that off.
That
Sorry.
audio.
Very excited to speak with you today. I got the suggestion from one of my viewers, and when I started to look into it a little bit more, I thought, oh, definitely, I got to speak to this woman. So, so I got a lot of questions. So let's get right to it. First of all, though, just please take 30 seconds to tell people, in case they don't know, in case they haven't seen the movies, in case they haven't watched you, who is Jessie Graff?
I'm a stunt woman and a competitor on American Ninja Warrior. So I've been competing for 8 years doing ninja obstacles. My claim to fame on the show that I'm most proud of is that I have, I think, for 6 years in a row, placed among the top 6 men. My highest ranking is second place. I lost to a world-ranked speed climber named Josh Levin that day. So that's always been really exciting. But I've been doing stunts also for 13 years now, doing stunts on Supergirl and Wonder Woman and lots of superhero things. But basically, my body gets the snot beaten out of me all the time. Like, that's in athletics, I'm pushing myself to the limits, trying to find where is that line of how strong can I get? And I sometimes push it a little too far, but then of course it doesn't help that at work I'm getting hit by cars. So I have a lot of experience with orthopedic injuries, and I'm currently recovering from 3 surgeries in 3 months. I had ACL surgery August 3rd, shoulder, it was like the labrum, the capsule, the rotator cuff, so like triple surgery in this shoulder August 11th, so 8 days after the knee surgery. And then 3 months later, November 6th, I found that I had torn rotator cuff in my left shoulder too. So that's my last one. I'm hopefully ever makes 12 surgeries total in my life. But that puts me at, where am I? I'm about 11 and a half weeks. So I'm going to get permission to lift more than 5 pounds in a couple days, which is a pretty big deal. So
giddy up, giddy up. All right. So with that introduction, please tell us first, why did you become a stunt woman?
When I was 12 years old, I was watching Buffy the Vampire Slayer and Xena, Warrior Princess, and I just always wanted to be an action hero on TV. My mom was a Broadway dancer and actress, and so she was like, oh, that means you want to be an actress. So I went to college, I majored in theater, and moved to LA, mostly with the intention to be an actor and do a lot of action films. But it was my last year of college when I found out that usually aren't even allowed to do all of their own stunts. And so I had to think about, like, well, if you're going to put your energy into networking in a certain field, because they are very different groups to network with, what's more important to you? Do you want to, do the emotional stuff and have everyone know who you are, or do you want to do like the superhero stuff, do the most amazing? And it was just like, I could feel it in my heart. Which one's more important? Yes, I want to do both. I still want to do both. But in that moment, it was like 100%, I'm in love with stunts. And so I dove into that full time, just training 24/7. I considered training for stunts my job, working, just like working out 8 hours a day, 5 to 8 hours a day, 7 days a week, which isn't conducive to recovering necessarily, but I gained a lot of skills really quickly. And it's just like, I'm still so in love with it. The amazing things I get to do. It's like I'm surrounded by world champions in like every different field of athletics, and they're all my friends, and we get to train together and teach each other things. And on top of that, when I go to work, they put me in like a crazy costume and set up the most elaborate stunts that I get to do for camera. So it's just like, it is a dream come true.
For sure, for sure. It definitely sounds very cool. And maybe if I went back in another life, maybe I'd be a stunt person. I'm not sure, but definitely what you do is cool. So here, let me ask you a question specifically about some of the knowledge that you have in your head. Why five martial arts? Why five? Why not one? Why not two? Why five?
My question to you is it five? Uh, I have the only two that I've gone through with like real structure and belt system are Taekwondo and Kung Fu. Yeah. Kamsahamnida. So most of my stunt or my fight training has come from training with different stunt people. I did a lot at like Inasanto Academy was one of my favorite places for a short period of time. But so they do like, gosh, 9 or 11 different styles. And then all my friends, like I said, are national and world champions at different styles. And so some of it is like I went to XMA for a long time, which is really more performance style. And I trained with a Wushu world champion for a little while. And I had a boxing personal and then worked out with some stunt guys who were pro kickboxers. And so it's kind of like my resume is like, okay, what have I trained extensively in that I'm able to mimic? So I say like I have a black belt in Taekwondo and Kung Fu, but I've trained in, and then it's sort of the list of like, sometimes I'd be training with someone for a year and be like, hey, what are we doing, by the way? Like I don't always have a title for what I'm doing. So if I were going to rattle them off, I'd be like, okay, Taekwondo, Kung Fu, Wushu, Capoeira, boxing, kickboxing, Muay Thai, a little bit of Muay Boran. I trained in Thailand with a guy named Simon Kook, who grew up street performing with Tony Jaa, who's, of course, one of my movie heroes.
Mm-hmm.
Yes, of course I'm a Bruce Lee fan, but Jackie Chan's my favorite.
There you go. Jackie, you know what? That's somebody I got to try and interview because Jackie Chan is a machine. And he has had so many orthopedic injuries. It is like, it's ridiculous, man. He is a true master, but he is very, very devoted to his craft, for sure.
Yeah, there are definitely moments in stunts where you want to make everything as safe as possible, but you can sometimes look at a stunt and be like, this is going to suck. Like, how do I not get injured, or where am I willing to compromise? Like, what's more important, my ankles or my head? Okay.
Mm-hmm.
Second priority, ankles. Like, most of the time it's like you've got your strategy and everything's set up and you have mats where you need them, but other times you're like, okay, I'm hitting the concrete. Like, how do I protect what's most important to protect?
For sure. So how do you think that martial arts has prepared you for the adversity that's associated with injuries? Like, has it? And if so, how do you think it has?
I would give that more to gymnastics because that was my foundation. I started martial arts when I was 22. So I had already, my whole foundation as a child was started in circus, and then gymnastics was my entire life, 22 hours a week, generally, like all through high school, and then pole vaulting. And so that whole foundation of how I approach hard work and adversity, and like after you fall, how you get back up again, and how you keep trying when you're terrified and tears are streaming down your face, how do you do it anyway? When you're injured, how do you continue training in a safe way? Okay, well, do you need your legs for bars? You need them for a dismount and a mount, but what skills can you work on? And if you fall while you're working on a skill, how do you land safely? Or, okay, it's broken, what skills can you still practice on beam? And do you know how to fall safely so you don't land on your wrist? So all of that came from growing up in gymnastics.
Mm-hmm. So if you were to look back now when you injured your knee, okay, so let's talk about the knee first, okay? And I watched some videos where you talk about that. Do you think, hindsight is 2020, is there anything that you could have done to prevent your knee injury, do you think? Or is it just something that just happened?
I think I had been slacking on my clams a little bit. clamps are one of the basic rehab, like any PT that you go to after a knee surgery is going to have you in clams where you have the band around your knees and you're laying on your side working on your glutes. Um, I think I had slacked a little bit on my leg training because I had strained my other hamstring in March. Like really minor strain, but enough to interfere with like, okay, my squats aren't working as well. I'll just lighten up on this. So a lot of my normal leg strength training, like the higher level stuff that I get excited about, was just not working. And so I was focusing on other things. And so I think if I had modified that and been like, okay, so you can't do heavy squats because your left hamstring's irritated. Well, what can you do? How about clams? That's a good idea. How about step downs and all the rehab stuff you use to stabilize your knee when you're not able to do the explosive stuff? But when it's that close to competition, I get so focused on what exactly do I need to get up the work wall? I need to be able to squat this much. I need to sprint this hard. Oh crap, I can't sprint. Well, what am I like? Let me do upper body. So I think my priorities were a little bit off there. And then of course, breaking down the film and looking at how exactly did I land. Okay, I landed a little sideways. I should have known to rotate and land forward, but I was a little focused on like, ooh, I could rotate and then run straight out of it so that I'm like connecting to the next obstacle. And you know, not the most important priority, but when you get comfortable landing from obstacles, the next natural step is like you want to flow more, have that continuous momentum. And if my legs were healthier, that probably wouldn't have been an issue. But yeah, little things.
Well, as I said, hindsight's always 2020. So, what type of graft did you have for your ACL?
What type of graft? Allograft, cadaver tendon.
Yes.
This is my second ACL surgery, and both times I went for the allograft. I think genetically, I just have sort of loose ligaments. I'm a little hypermobile, a lot, and I've had 26 ankle sprains. Kind of like I just understand that I'm prone to tearing my own ligaments. And so part of me was like, well, one, I'm not willing to compromise my hamstring. Like if I were jumping 48 inches high, then I'd be like, you know, I have hamstring to spare. But no, I want to jump as high as possible. Didn't want to sacrifice any of my muscle. And patellar tendon, I don't know as much about that, but I feel like if my ligaments are already sketchy, I don't want to take anything away from them. Plus, who knows, most other people don't sprain as much as I do, so someone else's tendon is probably going to be more trustworthy than mine. So.
Now, did they ever talk about quadricep tendon as an option?
I actually have not heard that one.
Okay. Yeah, no, I remember, you know, watching your video where you had talked about allograft, and I thought, well, young, active, female stunt woman, and they went with an allograft. But now that you talk about the, you know, history of ligamentous laxity, I'm like, oh, okay, now that makes sense. So I can understand why. Although you know, I'm curious as to why they hadn't, you know, didn't talk about a quadricep tendon. But, you know, it's not everybody's doing that, but certainly that's an option as well. And particularly for people who have a history of ligamentous laxity. So, but that's neither here nor there.
No, the main reason I've always heard that people go with their own tissue is because of infection. Is that the primary infection, or that the body would reject outside tissue? And since I've never had a problem with that, I just thought it made sense to go with outside tissue. But so, is there enough not to use outside tissue?
So ideally we would always like to go with autograft, which is tissue that comes from you. And the reason that we want to do that is because it is living tissue. At the moment that we take it out, or, you know, prepare the tendon, it has living cells in it. We're going to put it back into you. It's your own tissue. The body will recognize it right away, and it will increase the likelihood that it's going to take properly and that it's going to heal well. Allograft, which comes from somebody else, from a donor, that your body, it doesn't have any living tissue in it anymore because it's, you know, either irradiated or it's flash frozen. And because of that, there is a disadvantage right away because it has no living tissue in it or no living cells. It takes some time for that to be populated with cells from your body. And then because it's been out for a period of time, sometimes there may be some degeneration of the tissue. So for some patients who have multiple ligaments that require surgery at the same time, sometimes we have no choice but to use allograft because you don't have enough stuff for us to harvest, right? Or if we think that you're particularly going to need your hamstring tendon because you have medial sided injury or something, then we go, we're not going to use that. Maybe we need to use some allograft. But it's typically in older patients, that's something that we might go to instead of using their own, just because their demands are not going to be as high. Studies have shown us that in young active females, especially, allograft doesn't have a great track record. And when I say young, well, you're young, you're a lot younger than me, but also younger than you too. So it's surgeon's choice, but if we can, we try to use autograft whenever we can.
So does autograft typically have less tendency to degenerate?
Yeah. So generally, that's one of the main benefits of it. Less likelihood of degeneration over time.
Ooh, well, that's interesting because my first ACL surgery, and I had an allograft for that one too, was in 2014. And it was in 2017 that I felt like a little bit of a wobble. My muscles were really strong and stable, but I felt a wobble when I was in a weird direction. It wasn't an injury, it was just like instability. And I went to get an MRI and it showed that my ACL had degenerated and that it was kind of hanging on by a thread. And I really didn't want to have another surgery. So I tried stem cells and we injected straight into the ACL under an x-ray. And I made it through that whole next year on Wonder Woman and then another year and a half of competition or so. And it wasn't really on my radar. Like it showed up on the MRI that had helped, that it looked strong and stable. But then it was kind of out of nowhere when I landed and heard the pop on Ninja this year. Mm-hmm. So I had sometimes kind of wondered if that's what it was. But does that make sense over the course of like 5-6 years that, well, crap.
It's not always that way, but it's just, as I said, in studies have shown us that particularly in young active, in young active patients, but especially young active females, it tends to have a poor outcome in the long term. So, if we can, we try to stay away from it. But, being that you have a history of ligamentous laxity, then it kind of handcuffs us a little bit because we know that your tissue is not going to be great to use anyway. So,
yeah. Like I got a trade-off. I feel like my muscles function really well, but but I lost out a little on the ligament and tendon stability, strength.
There you go.
I'll take it, I guess. We all have our strengths and weaknesses. I can work around this.
Listen, man, a bazillion martial arts. You're a stunt woman. You do all this crazy cool shit. So yeah, no, you can take it. Just don't for that one little thing. I wouldn't worry about it.
Yeah.
Right. So, sorry?
Someone asked what we're talking about. So anyone who's just joining us now, we're talking about orthopedic injuries and stunts and ninja, right?
Yes, exactly. So speaking of injuries, so we talked a little bit about your ACL. Tell us about your shoulders. Now, from what I understand, this was a season 12 injury from falling shelves, but tell us what happened with your shoulders.
So yeah, it was a really rough couple days. It was, so the knee actually happened on a Saturday while we were shooting a special episode that hasn't aired yet. I don't even know if it'll be noticeable because I didn't actually fall. It came back to normal position. Um, I taped it up with K-tape. It felt really unstable, but I made it through the semifinals on the Monday following that Saturday. And then on that Wednesday, it was the third obstacle. I jumped to this shelf. I grabbed it, and as it went away from me, I don't know, I think I like loosened my core. It got away, and I wasn't able to decelerate, so it yanked there, and shoulder subluxed. So it tore the inferior glenohumeral ligament, the supraspinatus. I already had some prior damage in there, so there was already like the supraspinatus had like tearing previously. There was the cartilage damage, the labrum. I think there was maybe some tendinosis in the subscap. The left one was fine prior to that, though. So this one came almost out. Like I felt the head of the humerus leaving, and that's when I let go with my fingers. But it also was enough impact to tear the rotator cuff in my left shoulder in that moment. So I'm like, I don't know why I took so much impact on this one obstacle when, you know, a lot of my friends made it through. The only thing I can think of is I'd gotten stem cell injections in my shoulder earlier that year to try to strengthen that supraspinatus. And so I had to take some time, had some atrophy. So I was rebuilding my shoulders. And during that whole time, I continued grip training. So normally, I think if you take an impact with your hands that's strong enough to rip your shoulders out, your fingers are going to be the weaker link. And so in this case, my fingers were strong enough to like cling to this thing, even though my shoulder didn't have the strength to support it. So I just like held on beyond what normal people would do. Just, you know, that moment of stubbornness of like, I will hold this. Oh dear.
Maybe not.
I was like, as I fell, I was like clutching my shoulder, trying to put it back in, and landed in the water and came out and was testing it and everything. And it wasn't until a few days later that I was like, wait, why does this one hurt too? I wasn't really ready to look at how much damage had been done until maybe a month after this surgery. I just like, I couldn't even process the idea of like, what if you need 3 surgeries right now? Like, it was too much. I was like, you should get an MRI of all 3. And I just couldn't. Ugh. It was a lot.
Well, certainly it's a lot to digest, you know, in such a short period of time to injure 3 different joints of the body. Yeah. And potentially they all need surgery. Definitely a lot. Definitely a lot. So let's skip forward a little bit and let me ask you a question about, you know, so you've been through several surgeries at this point, and you mentioned that you'd had an ACL reconstruction in the past. How do you determine your readiness to return to training after your rehab? So obviously rehab is you know, immediately after surgery, and then at some point rehab becomes occupation specific, sport specific, activity specific, and so then it starts to change from rehabilitation to training. So how do you know when you're ready to do that? Are you doing this based on a time-based approach, or are you using some other kind of criteria to grade readiness?
It's a combination of things. The biggest one, and actually I'd love your input on this, is if I always have to ask my doctor, where can I use my judgment of like, if this feels comfortable and doesn't hurt, can I trust that? Or is there something in there that's unstable that's like anchoring in there? Like, when do the new tendons solidify to a point where they're strong and stable? So like, one of the things I'm told on my left shoulder is even if it doesn't hurt, the supraspinatus is going to take at least the 12 weeks to be strong, secured, anchored enough to where I can lift more than 5 pounds. I know he's playing it safe on the 5 pounds, but even if it doesn't hurt, if I feel like I can, you know, whoops, I accidentally picked up a bag that's more than 5 pounds. It didn't hurt, it felt fine, but am I putting too much tension on the supraspinatus? So I try to really respect those guidelines because, you know, if I can't use pain as a guide, then I need to know where I need to be careful. Um, so I know like I'll start building up very gradually, and then my second criteria is using that pain as a guide. If he says, okay, you're cleared to unlimited weights, I'm not going to go, okay, well, cool, let me lift 20, 30, 50, like whatever I used to be able to do, whatever my right arm is allowed to do. I'm going to go, okay, 5 pounds felt way too easy. Let me try 6. Okay, 6 is still stupidly easy. Where do I feel a pinch? And so normally what happened with the right shoulder is I would start really low and just add a little bit. And then the limiting factor is usually a pinch. So I'll feel like a slight pinch, kind of like along my biceps tendon, which I didn't have damage to my biceps tendon, but that's where I feel it. And so I'll kind of back off from there. And so with a lot of things where I can do 30 pounds pretty comfortably with my right arm now. But if I go up to 40, it starts pinching a little bit, but 30 is feeling really easy. So I'll just increase the reps. So I'm just trying to strengthen gradually in whatever way feels comfortable. Focusing on alignment. I was doing my pull downs because I'm obviously not going to do a full pull up, but I can do cable pull downs. And so I'm focusing a lot of the way that I set myself up for shoulder injury was by going into positions that felt stronger and more comfortable, even though the alignment wasn't good. So instead of doing pull-ups here, I was kind of rocking back to here and going there. I wasn't kipping, but I was not going through the correct range of motion. I've been talking to He's a lot about that, and we've kind of concluded that like I have really tight teres muscles, I think major and minor, but I have a lot of laxity in my thoracic spine. So it's way easier for me to keep this shoulder angle and to stick my ribs out, which now puts my shoulders in a compromised position where like the head of the humerus isn't really centered. When my arms are up and I'm here, it's kind of pinching the supraspinatus. Oh, quick question on that. When my arms are overhead, that's actually stretched position for the supraspinatus, right?
No.
So it almost feels like the supraspinatus wasn't getting like stretched and torn. It's almost like it was more severed from being pinched. Is that an accurate or reasonable?
Well, so the thing is, you're not stretching the supraspinatus in that position, but depending on your hand position, you may bring the supraspinatus closer to the acromion, so the corner of your shoulder blade. And particularly if your hand is internally rotated, so if you have an overhand grip, and depending on how you're falling or hanging, with that internal rotation, you bring the greater tuberosity of the humeral head closer to the acromion, and your supraspinatus is basically going to attach there. So you bring those surfaces closer together. So that can, I guess for lack of a better term, avulse the supraspinatus attachment, or abrade the supraspinatus attachment right off of the bone right there, and you can have a tear because of that. And especially if you have tension in the supraspinatus as you're doing that, like it's bad enough to just have your hand overhead, but if your hand overhead and you're generating tension there through the rotator cuff, then that's probably going to be even worse.
So it's kind of like if you had a rubber band that's loose and you kind of like sliced at it, it might not break, but if you have it pulled tight and you like shear it with a bone and pinch it, it's far more likely to snap.
Yeah.
Okay. So it's a combination of it being like stretched, pulled tight, and then pinched between bones.
Exactly. And part of the thing that you said there is very important. You know, if part of your rotator cuff is weak, right? So if your teres minor, teres major are weak, then you start to have poor scapular positioning, right? And I often say to people that the scapula is the stage upon which your shoulder performs, right? And so if you have poor rotator cuff muscles and your scapula, well, the rotator cuff doesn't necessarily position the scapula, but if your scapular muscles are poor and you have scapular dyskinesis, that sets your shoulder to be up in a poor position, right? And if your shoulder is in a poor position, as you yourself mentioned, when you are doing things and you're having to compensate for that poor shoulder positioning, then you are more likely to have your scapula in a position which is going to endanger the rotator cuff when you have your arm overhead, right? So
Yeah. I do a lot of focus on external rotation, just like tons of different this way and this way. And I have a cable machine where I'm measuring for 8 reps, how much weight can I do this way versus this way versus that way, this way versus that way. And my PT is always saying like the internal rotators are huge muscle groups, like what lats and pecs and everything wants to pull in. So those are easy and it's hard to balance out with like your little infraspinatus. And I mean, what else do we have there?
along the
The
back, you have you have the deltoids, the posterior delts. You have the rhomboids, right?
Mhm.
You have the
Yeah.
teres major and minor. So it's interesting. You know, I spoke to Matt Wenning, who is who was a world champion powerlifter, and he was one of the guests. And when I talked to him, he was talking about when he was training the Army Ranger. So he's not doing this anymore, but one of the things he did is he did all of the strength and conditioning training for the Army Rangers, 25,000 soldiers. 25,000 soldiers. And one of the things that he talked about was he programs whatever they're doing for the front, he does twice as much for the back, because basically our backs are neglected. And as you said, all of our internal rotators, our pressing muscles, all of that stuff is not that it's overdeveloped, but in comparison to the stuff on the back, it's like greatly more developed than what we have on the back. So, and this sets us up for injury because there is an imbalance between the muscles on the front and the anterior muscles and the posterior muscles, our pushing muscles and our pulling muscles. So he would always program twice as much. And I think about my own time in the gym. I certainly don't do twice as much on the back as I do on the front, but his conversation and his point in the conversation really made me think, oh, yeah, you know what? I really need to concentrate on this more. And even knowing this as an orthopedic surgeon that works on backs, works on legs, I really need to spend more time working on all the stuff on the back because that's how we maintain the balance and help to prevent injury. Studies show us that if we incorporated just one exercise, Nordic hamstring training, into your lower extremity workout, you can almost decrease the incidence of ACL injuries by half. So, and people never want to do that, right? Like they want to squat, they want to do leg extensions, all the stuff they can see. It looks great in the mirror. Nobody wants to do the stuff that's on the back. It's not the glamorous stuff, but that's the stuff that's going to save you.
Yeah. Yeah. No, I definitely do a lot of focus on glutes and hamstrings because I do know being quad dominant is one of the big problems that leads to ACL issues. But I think I had done so much focus on that after my first ACL surgery that I was like, oh, you did it. Like I felt like I had done that and compensated for it to the level where it was just normal.
Mm-hmm.
After that little hamstring strain that I kind of like slacked off and didn't notice. It was like, if people recommended a certain exercise, I'd be like, oh yeah, I do that all the time, without really connecting to the fact that no, you used to do that all the time. Is that still in your routine? And so I've been doing like almost every morning now, I'm looking at my old routines and I have each like a worksheet for every day and I'll have to go through and be like, okay, are you doing all the things? What have you left out? Oh, you haven't done monster walks in a while with the band around. Okay, where does that fit in that I can make it part of the everyday? Like, this needs to happen every week. Does it need to happen every day or every 3 days? And so I'm revising this because I really want to make sure that I have a program that I can just, if I'm too tired to think about exactly what to do every day, I want to know that I have my worksheet where I can just check off all the stuff. And I'm trying to do some research on, like, I found some resources on if you can internally rotate this much weight, what's the proper balance? How much should I be able to externally rotate? Because like, internal is a much bigger muscle group. It's not necessarily realistic to be equally strong in both directions. But what is the right balance? How do you know if you're overdeveloped? One of the things that I heard is you should be able to bench press as much as you can row, or pull as much as you can push. And so I'm adding up how much weight can I do on a pull-up, including my own body weight. So my best single pull-up was, well, I shouldn't compare single pull-ups because I can't rep max. It's 1 rep max of bench press. But I was able to do almost twice as much weight pulling as I was pushing. And I was like, wow, those should be equal. So I'm like more than double off on that balance. And so as I'm rebuilding, I'm trying to make sure that, like, if I feel like I can pull, if I'm getting up to 40 pounds on my pull downs, but my bench is still stuck at 30, I'm like, okay, go back a little. We're going to let it balance out, because I want to make sure, as much as I get excited about getting higher numbers, it's more important to be stable and balanced.
For sure, for sure. So, and speaking about stability now, obviously after you rehabilitate after an injury, you have to have, you need to be able to restore your range of motion. You need to restore your strength and your mobility, so strength through the range of motion. But you also need to develop proprioception skills. So how did you train stabilization skills, proprioception, after your injuries?
In the mirror. And I'm doing that a lot right now, because it's like my knee surgery, it's only 5.5 months out. And it feels normal. Like, I can walk around and drop to the floor in like a kneeling stance, like a little kid, and I don't notice that there's anything wrong with my knee. But I think the proprioception is a little bit off. I was playing the other day, testing my vertical jump. How high can I get on each leg? And the explosiveness isn't there on the right leg yet, where it's still there on the left. So I'm over 6 inches difference between the legs. But I was looking at the video, and I'm having like knee valgus. As I take off, my knee's collapsing inward.
Yuck.
Still completely set up to re-tear this if you were to go do that. So I'm going back in the mirror, and when I do my step downs, just like, I'm getting on here and just like doing that, or stepping down, and watching my knee in the mirror. Is it tracking perfectly over my second toe? And as long as I'm focusing on it, yes. But the second my focus shifts away, it goes in a little, it wobbles a little. So I'm trying to rep those, and then doing little things where I'll hop up onto a 6-inch box and hop down and just like stare at that alignment and just rebuild that muscle pattern, because I don't know, I feel like it should be there, but for some reason it's not. So that's just something I really need to focus on. So I don't get to necessarily play with like, what's the highest I can jump? It's that rebuilding time where I just need to look at the alignment and make that the game.
Well, so at some point we have to take our ego out of it, right? It's always nice. It's always nice to get bigger numbers, right? I went higher, I lifted more, I did whatever, right? But at some point, particularly after you've been injured, it makes sense to be able to say, you know what? I need to be able to do this with better quality, right? And there are so many athletes that when you go back and you look at film, and you say, oh, geez, you know, this guy, for example, RG3, right? Like, guy was a phenomenal athlete. But when you look at some of the film of him moving, you go, oh, that's an accident waiting to happen, right? Because his movement quality was not like, don't get me wrong, dude is phenomenal athlete, but his movement quality was not that great, right? And you could say, geez, valgus, when he's moving, dynamic valgus, and if it's not an ACL tear yet, guess what? It will be, right? And so, yeah, it's good to hear that you're taking the time to really focus on that movement quality, right? Because you want to have those reps, those good quality reps, and build up that as you say, that motor pathway, so that when your body has to do it involuntarily and not be thinking about it, not be focusing on it, you want your body to say, been there, done that, got the t-shirt, watch me roar, right? You don't want to go, oh snap, what am I supposed to do again? I don't remember, you know?
Yeah,
So
that's where I was with my shoulders. And still, as I'm coming back, I film it from the back. I watch all the muscles, and then I send it to my physical therapist. I did this a couple days ago because I was like, I think I got up 38 pounds maybe of just like pull down, and I'm focusing on like locking in my scapula, using my lat, pulling down, and not letting it come forward at all.
mhm.
And so I was like, I almost look like I'm using my upper traps again, and they're like, yeah, you are, back off. So I had to go, and it was like 32 pounds. I could still do it and keep this relaxed and just use that. And the next day and today, my whole like thoracic back, like lower traps, lats, everything is so sore in a way that I've never felt it before. And I'm like, oh, you woke up the muscles you're supposed to be using. So it's so much to increase the weight and go into the muscle pattern that I'm used to. I got up to 43 pull-ups using the muscles that I was used to using. And so backing off and changing the muscle group is frustrating, because I'm like, well, these are supposed to be the stronger ones. Why can't I do as much? And then there's also the temptation that I was doing before, where I was like, okay, well, let me work with light weights, trying to build up the proper range of motion. But I need to be able to do the dynamic, like big moves, higher reps in this one that I'm comfortable, because that's where I can get the higher numbers. And I'm competing next week. So it was just reinforcing those patterns that I already had. So I'm hoping that by training the right muscle groups, once they get used to firing and rebuilding, that overall my strength will increase beyond what it was before, when I was using maybe, would it be secondary muscle groups rather than like the primary movers?
Yes, for sure. And you know, interestingly, one of the things that I'll tell either patients or people that we train in our facility, I'll say, you know, what we are going to do weakness-based training. And they're like, what are you talking about? And I say, well, whatever you suck at, that's what we're going to spend time doing, because the other things, you're good at those already. And it's not going to be the things that you're good at that are going to injure you or create a problem for you. It's going to be the things that you are weak at, and where you're trying, your body is saying, Jesse wants me to do this, but I'm not really strong enough. So how can I cut corners to make that thing happen as best I can, right?
Mm-hmm.
And those are the things that are going to end up injuring you, right? So those are the things that we try to address for people. We make people uncomfortable intentionally, because we say, well, what is it where are you weak? What is it that sucks? Let's fix that first and get that going. Because if you're looking for performance, right? Everybody wants to be bigger, faster, stronger, and we can all work on bigger, faster, stronger. But when you're competing at the level you're competing at, everybody's big, fast, strong. Everybody is. It's not the bigger, faster, stronger things that's going to make the difference. The things that are going to make the difference are the weakness, your areas of weakness, right? And if you can eliminate those or minimize those, then you allow all of your strengths to really shine, right? So that's what we try and convince people of. And then they don't always listen, but I think that's, you know, when you look at the people's performance, that's you know, the proof is in the pudding.
Yeah, definitely. The frustrating thing is that I knew that and I was working on that, but I wasn't really fully embracing it. I was trying to do both. Um, and it's just like now I got knocked into this lower position where it's like you're doing low numbers anyway, fix it now. Fix it
Yeah,
while
yeah.
you're rebuilding. Start those from the beginning. But like you said, I feel like one of my strengths as a ninja athlete is that I am very good at compensating for areas of weakness. If I'm missing an arm, I'm going to get really good at using both legs and the other arm to work around that. And same thing in little muscle groups. If I'm like a little tweaked in one area, I'm going to change my position to make it work. And that's super useful in competition, on courses, trying to be as efficient as possible, making each move as easy as possible so you can get farther in the long run. However, it's really bad for training because in those moments you want to be
Mhm.
hitting all the weak spots rather than skipping them. And so it takes extra
Mhm.
focus for me to be like, okay, don't find the most efficient way to do this. Find energetically the least efficient way, basically. Find move through the hard parts, spend the time in the hard parts,
Mhm.
target those and be like, okay, we're gonna just sit here. Sit here until this is the
Yes.
easy part. Um, that's why I really like
Listen, man,
super slow.
your body is always talking to you, and it's telling you what you need, right? Because that's where you're weak, that's where it's uncomfortable. That's your body saying to you, hey, spend more time right here, this thing, do this more, you know. But we tend not to listen to ourselves.
Yeah,
So
kind of like kipping
let
pull-ups.
me ask you, sorry.
Like kipping pull-ups is always the example I use, where it's like if your goal is to get your chin over the bar the most times possible, those are great. Or if you're trying to
Yes.
like hop over an obstacle, great. Understand that technique. But if you're trying to build your muscles and get stronger, well, no, you're just skipping all of the strengthening. Like this is not a pull-up. This
Exactly. Momentum is not your friend.
well, it
So
isn't.
what role, sorry.
It is in ninja, but not in strength training.
Well, no, that's true. That's true. That's true. So what role did hyperbaric? I watched several of your videos, and you talked a little bit about hyperbaric. You talked about some ancillary modalities that you've used in your rehabilitation. So hyperbaric oxygen, stem cells. So tell me, what role did each of those things play in your recovery from your injuries?
So I started doing the hyperbaric chamber a couple years ago after I had a concussion. I was really frustrated because I found that I wasn't able to focus and memorize as well. Like my typing had gotten weird. Um, and it was just like things were more mentally exhausting than they should be. And so I was looking into what are all the things that I could be doing to help my brain heal. Um, and so I started doing this hyperbaric chamber, that tension. Um, Also knowing that sometimes it could possibly help with recovery time and healing and everything. The first thing I noticed was on my second session, my neck, where it feels sort of like stuck, would like loosen and I would get all these cracks, like my hips would like open, things where I was stuck felt like they just opened. So that was the most obvious. But it was after a long time of going a couple days a week that I started realizing like my interest in TV shows had shifted from like sort of like empty reality shows to more educational reality shows, and then to documentaries, and then like to YouTube videos about glycolysis. And like, and I was like, oh my gosh, I want
My
to learn
brain is
things
coming
again.
back.
I'm like alive. And now I'm like, I still like watching documentaries, but I'm like stuck in my textbook learning about energy metabolism. And I'm like, this is so cool. I'm feeling sad. And like, I'm so excited to be learning. It's like I can't I can't watch TV because my brain is racing about like the things I'm trying to learn. And I'm like, let me watch that sign language song again so that I can like get faster and memorize. And I'm like on the elliptigo instead of, or it's an elliptistay, I call it. But on there, instead of like watching a TV show, I'm like playing my sign language songs and like practicing, like getting up coordination and mobility while memorizing and learning language and doing my cardio at the same time. And it's just been really exciting to see that transition. And some of it is just like, as you force yourself to focus, my brain has like strengthened as a muscle. But it was like, I felt like I didn't have the mental strength to do that after my concussion. And the only thing I changed initially, not the things, was going to the hyperbaric chamber. The others were like I tried to start eating more fats and supplementing with more. Um, but those are the main things I was doing, and it worked.
Okay. Well, listen, man.
What was the other
again, thing? The proof is in the pudding. Stem cells.
Stem cells. I'm still not sure. I'm like because I use them on my knee, and the positive result that I got from that is my knee surgeon, who I initially went to with my MRI. He was like, "Yeah, it's hanging on by a thread, but it's not like you're still so functional. We don't want to just do a surgery on you're going to be out for a year. So why don't you just keep strengthening, do what you do, and when it snaps, we'll have surgery." I was like, "Great, that sucks." So I got this, and a year later, I had an MRI and brought it back to that same doctor. He was like, he didn't believe in stem cells. He thought it was going to be just a waste of money. And so I brought him back my MRI after the stem cells, and he was like, "Why are you showing this to me? This, like, do you think there's something wrong with your knee? The ACL looks fine." And so the skeptical doctor basically confirmed that it had worked. How a year and a half later, I tore my ACL. So it's sort of like, it looks like it worked, and then it just got weaker again. And then in the same way, like I had the stem cell injections on my right shoulder because there was a partial tear in the supraspinatus and like the cartilage and the labrum and all these things. The main one that definitely healed was the tendinosis in the subscapularis. Those things, and the ultrasound showed that tendinosis was gone. However, months after those stem cell injections, I subluxed my shoulder, and when I got the MRI, all of those things showed up only worse. Well, not the tendinosis. That one went away. So the question is, did it heal and then completely re-tear, or was it still compromised and that's why it re-tore? The fact that my left shoulder the fact that my left shoulder tore from zero damage leads me to believe that, like, even if the stem cells had worked completely, if there was enough damage, enough impact to yank this shoulder out, why wouldn't there be enough to yank this one? So it's sort of like it probably helped some, but there's no evidence to prove it. There's also evidence that, like, well, it couldn't have worked that well. So I don't know. I think it helps, but I think there are certain injuries that it's not going to be enough. So
yeah, no, and that's, I lean more towards the skeptical side, and I don't think that it does nothing. I think it does help to some degree. At this point, studies, I saw somebody in the comment ask stem cells. Scott McGarrigan asked whether it's stem cells or PRP, and at this point in time, I think studies show that they're about equivalent. They're certainly not equivalent in terms of price, but in terms of effect, they're probably equivalent. And if anything, I would say that maybe stem cells is a little bit PRP plus. Not enough plus, though, I think, personally, to justify the price. And I'm in Canada, so it's a little bit of a different system here, but still people pay for that out of pocket. And for me, I think the difference the difference in result is not significant enough that I can justify saying to somebody, hey, pay for this thing. Like for us, you do here, we do, if you do PRP, and even that I do sparingly, but if you do PRP, it's about $500 Canadian dollars. Okay. If you do stem cells, it's anywhere from $3,500 to $5,000, right? So, you know, in my mind, I'm Jamaican upbringing. I'm Canadian, but Jamaican Canadian, right? So I'm stingy, and it's like, if I'm going to pay 10 times more, I should potentially get 10 times the benefit. And it's not even twice the benefit. So to me, I go, I just don't think that's worth it. You know what I mean? But it's not to say it doesn't do anything. And by all means, if you have the means to do it, then, and you're looking for something to do, you know what I mean? Then yeah, that's an option. But at this point, I think PRP, stem cells, probably equivalent.
I think that's the direction I would lean now after my experience this year. Yeah, it is close to 10 times the cost. The direction I was thinking was it's the same amount of downtime. And the bigger cost to me is how much work am I missing? Activity am I missing? If I'm going to have to take 8 to 12 weeks to recover from these injections, I want the maximum healing from that. And if I'm in a position where I'm like, would I rather take 6 months out for surgery or 8 to 12 weeks out to recover from some injections? I want the most powerful. So that's the direction I went. I think maybe if my injuries had been a little less severe, or if I'd had a little more time to recover before competition, maybe it would have been enough. But I think at this point, I would probably just lean towards PRP. And if PRP is not enough, then maybe you need surgery. It's a basis. But then also, I think looking back, I can observe a little more about how confident the doctors were. In certain areas, they're like, oh, on this, we have great results on a supraspinatus. Or, you know, it might work on your ACL. Like there's definitely a difference in confidence from the doctors on which structure they're treating and how well it responds to PRP or stem cells or not at all. And I think my wishful thinking, my hope of like, I really don't want surgery. Like I think really steered my decisions. But I was pretty close to that.
Well, you know, I often say to patients, I often say to patients, you know, when I'm talking to them about their injury, I say, hey, you know, you have this. You're welcome to do physio. You're welcome to do injections. You're welcome to do whatever. But at the end of the day, this is a mechanical problem. It's broken, and it's like if you had a hole in your roof of your house. You can paint the walls inside the house whatever color you want. You can dress it up all nice. But if you got a hole in the roof and I can see the sky, it doesn't matter what color the inside of the room is. I can still see the sky. And sometimes at the end of the day, these are mechanical problems, right? Like you can do all these other things to it, try to make it look pretty, but if you got a hole in the roof, you still have to cover up the roof, right? You need to repair the hole in the roof. So, yeah, but that's just my personal opinion. But that's how I explain it to some people.
Stem cells is a little more than repainting the ceiling. I'd say it's maybe like moving a couple shingles and putting down like maybe like plywood and shingles.
Well, no. So you might put shingles over the hole, but you didn't put any of the plywood in. So yeah, you're right. I might need to change my analogy when I speak to people about stem cells. But yeah, it's sometimes it's just a mechanical thing. And the other part of it is that some of the stuff that's required with stem cells, like the duration of time that you need to allow it to work and you know not stress or load the tendon during that time, a lot of people are not prepared to do that, right? Like if they're not as stringent as they need to be. So that's not another consideration.
Yeah.
So I got two more questions for you.
Okay.
Okay.
I'm going to back up.
The hospital was calling me there. So, question. What are your thoughts on, and you've spoken about this, so this is what I'm going to ask you. So what are your thoughts on the importance of strength training in women?
I'm moving because I think I'm breaking up a little bit. I don't want to be backing up towards the stairs. Okay. I'm listening.
No worries.
Strength.
Okay, so
What?
what are your thoughts on the importance of strength training in women, and who should strength train?
Everyone.
Yeah, I love that answer.
I think, I mean, it's just, I always talk about, like, with pull-ups specifically, if we're hiking and you, like, fell off a cliff and we're hanging onto the edge, it would be nice to be able to do a pull-up and just get back up and keep walking and not have to, like, hang there hoping someone pulls back up. There are basic life skills and safety skills that strength training can help you with, for preventing injury. Like, I think I'm not necessarily the poster child for strength training preventing injury, but I'm also exposing myself to way more injury. But like, my mom is simple. If you look at her 6 or 7 years ago, she looked healthy, pretty average, but she was like, she had osteopenia, so she was like pre-osteoporosis, and so she got a trainer. She's been doing strength training. Now she's 69 and can do 15 pull-ups and has completely reversed the osteopenia. She has like super strong bones. So it's just like basic health. I think a lot of women get discouraged by, not being able to get as strong as quickly. If I were to start strength training with a muscle group that I've never had before, at the same time as a guy, he's just going to build muscle faster than me, and it can be discouraging. Testosterone helps, and I'm super jealous of how fast guys can gain strength. However, that's why it's extra important for me to do that base strength training and make sure that I have that strong foundation so that I can go play and do all the cool stuff that they're doing. I just have to be more diligent, more disciplined with doing that foundation work. But yeah, you want to know that your legs have the strength to slowly cushion your landing. It's just like a lot of safety stuff.
And I love all of that is gold. Okay. But there's two things in particular that I love. Number one, that you used your mother as an example, and she said she's 69, and then number two, that everybody should be lifting weights. And I tell this to people all the time. We should all be lifting weights. I don't care how old you are, what sex you are, we should all be lifting weights. After the age of 35, our level of lean muscle mass starts to decrease, as does our bone density, right? And the only way, like, just because you feel good doesn't mean that you are slowing that or stopping that in any way. And the only way to do that is to load the muscles, right? Load the muscles, load the bones. And the only way we can do that is either hard labor or resistance training, right? So I think everybody should be lifting weight, and I love that. And the fact that your mother can do 15 freaking pull-ups, like,
insane.
Up.
And it's not like she was doing that her whole life and like picked it back up again. She had never done a pull-up in her entire life.
Yeah.
Or it was crazy.
No, I think that is awesome. I think that's awesome. Listen, this has been an amazing conversation, and I thank you for sharing all that, sharing your experiences with us. And there's a lot of golden nuggets here that I think people will be able to take from our conversation. And I want to say, because I was just reading the comments as we're going here, and Janelle Horner says, "Could you stop attacking her decisions?" they did what they needed to do. Just she needed more. Listen, I'm not trying to attack your decisions in any way, shape, or form. You know, I'm having a conversation, and I'm telling you, just we're talking about, you know, you're talking about your experience, and I'm talking about my understanding.
Yeah.
I don't criticize your decisions in any way, shape, or form. The decisions you made are between you and your surgeon. I do not know all the circumstances and that went into making those decisions. So this is not meant to be an attack in any way, shape, or form. I'm having a great time chatting with you, and I think that this is I think it's been quite beneficial to hear different sides of you know, the equation. So I thank again. I got to thank you for participating. I got one final question, Jess,
Mm-hmm.
and I'm sure most of the people know this because you know they follow you already. But where can people find you online and find out more information about you?
I post the most stuff on Instagram and Facebook. I think you can see my handle here. It's Jessie Graff Power, JessieGraffPWR. But that's always just like whatever's up to date, most recent. I think I have like a decent bio and like background on myself on my website, jessiegraff.com.
Giddy up. Well, so once more, I want to say thank you very much. I greatly appreciate it. And as I said to you before, if you ever have any questions, no, not that I know much at all, but yeah, if you have any questions, shoot them my way. I'd be more than happy to oblige. For everybody else who participated and who was here to listen to our conversation, thank you very much for attending, and I hope to see you guys on the next one. Hang on Zoom there, Jess. I'll wrap up with you there. But to everybody else, thanks. Have a great day.
Thanks, everyone.